everyone, and welcome to Alzheimer's Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
Well, hi, everyone, and welcome to Alzheimer's Speaks. Today, we're going to do an open mic session. I'm your host, Lori LeBay, founder of Alzheimer's Speaks and co-founder of Dementia Map. I never know who's going to join us, so it's always a surprise. Sometimes we have one person, sometimes we have many, so we'll just kind of go with the flow. But it's all about having an open, honest conversation in a respectful fashion, bringing awareness and light and hope to the world of dementia. So let's peek behind the curtain and see who's with us today. Well, the curtain has been pulled open, so let's see who is with us today. It looks like Nancy is with us. So Nancy, welcome to the show. How are you doing?
I'm very good. Thanks for having me.
Well, I'm thrilled you're with us. Why don't you tell us a little bit about yourself and the company that you work for?
Sure. So I'm Dr. Nancy Berley. I am a board certified family physician. Been in practice for a little over 20 years or so. About 5 years ago, I found myself in the virtual space, and a few years ago found myself with the company I'm with now, which is Tembo Health. And Tembo is really, our mission is to make senior care more seamless. And so one of our most recent and exciting new programs that we've started to work on is dementia care management. And we've been accepted to CMS's GUIDE program, so we can provide this for Medicare beneficiaries. And it's really been so interesting to take this journey and to learn so much about dementia and about really trying to improve the lives of those affected with dementia.
Well, it's definitely a need out there for sure, and
Yep.
I was kind of investigating, trying to find out more information about the GUIDE program. In fact,
Yeah.
Amy House, that works for your company, just met with one of my support groups, and they were thrilled to talk with her and learn a little bit more. But so many people don't have a clue about the GUIDE program, and it's critical, especially when people are evaluating their Medicare programs right now, because you have to be on certain programs in order to even qualify, if I'm not mistaken.
Correct. Right now, in order to qualify, you have to have traditional Medicare. So those Medicare Advantage plans are not covering it at this point. So just those traditional.
Yeah, and that's, so many people have taken advantage of that. I know my insurance broker said more than half are on Advantage programs because they're cheaper. But again, if you can get support, it may easily be worth the extra money to do that. Why don't you explain to our audience what the GUIDE program offers? Because it's not just for the person with dementia.
No. And in fact, sometimes it's more for the people supporting that person. So the GUIDE program is a benefit for the person with dementia. That person has to be the Medicare beneficiary. But like you said, it benefits much more than only the person with dementia. So you are given access to a care navigator who you meet with at least once a month, but they're always available, whether it's through text or phone. And they're sort of your primary, source of all of those questions that are not quite the questions for the doctor. I can remember when I was in practice as a primary care doctor, seeing people struggling with aspects of dementia that I did not know enough about. I knew about the medical piece, but I had a patient's son say, I don't know how to bathe her. And I didn't really have a good answer or good resources. And so this is what that care navigator can do, is provide education and support, resources, try to troubleshoot what to do when you need help in the home, find other resources. Perhaps there's day programs in the area, offer some support and education around behaviors. We know that there's a lot of symptoms of dementia that not everybody necessarily identifies as a symptom of dementia. And so our care navigators can help with that and help people understand the best way to manage those symptoms. We also can sort of coordinate care. We don't take over the care. You still have your primary care doctor, you still have any specialists that you have, but sometimes it can be a little confusing. One doctor tells you one thing, another doctor tells you another. Maybe you just came out of the hospital and you're not sure which medications you're supposed to take. Those are sort of the transitions of care that we can help to manage. Part of the guide program also requires that there's be 24/7 access to your care navigation team. We've taken it a step further because we already have a 24/7 virtual urgent care staffed by physicians available. So our families have access to those emergency room physicians virtually. And then the other piece is that for some families, there is up to $2,500 per year in a respite benefit to pay for either, help in the home or to have your loved one go somewhere for a few days to give you some respite. The goals are really to keep people safely wherever they are, if that's home or wherever they are, as long as possible, and to really help with that caregiver burden.
All those points are so important. My mom lived with dementia for 30 years. So I get all of those questions, and you don't even know what to ask because you don't know what's available. But the emotional support I found extremely lacking, and the social support, which were actually the two grounding things that made life manageable in caring for my mom, was once I hooked up to those. And so I think the navigators play such a huge role because, again, it is the physical tasks of, just arranging appointments and communicating with the doctors and, doing the grooming and all of those types of things. But it's, how do I have my relationship with my loved one, and how do I maintain my relationship with others in my lives, in terms of that balance that, people just say, I'm losing it. I can't do this, because they need to be filled. So I think it's really a huge, huge step that CMS is taking with the guide program to support, the person who's caring in the family, because without them, the care is going to decline and everybody's going to end up getting sick, with those things. You had mentioned about maybe respite with adult day or getting help in the home, which it can be a huge burden because finances, of course, are difficult for most families. And, they struggle with, how are we going to pay this? And $2,500 sounds like a lot of money, but it gets eaten up pretty quickly as well. So you have to be realistic, but it's definitely a step in the right direction. And then trying to be able to find these resources is so difficult. So having someone in your corner that can guide you, to where to go and, maybe how to spend that money in the best fashion, for all of you. It might be purchasing product that, like a company called Twiddle has these sensory aids that are absolutely fantastic. They're like little muffs, but they have little fidgety things all over, and they can give warmth and comfort and can really help with people in terms of decreasing anxiety, or what we call sundowning, kind of around that agitative state, and give great comfort, and not real expensive, but can be a really powerful tool. Or even, music. We're hearing so much about that. So iPods or even an iPad that can engage them in a safe, simple fashion with their music is a one-time kind of prescription. I'm huge for like the social prescriptions. I think that's been a missed target for many, many years. And from my experience with my own mom, and then now being in this space since 2009, that's what I focused on, because people were missing those connections with peers and feeling like they were still part of community, and with people that understand, because not only do the doctors and nurses not always understand, because you've got your medical, processes that you follow, but family members don't understand either. And a lot of times we'll look at the person who's caring like, you're nuts, they're fine, I was just there. Yeah, you were there for 15 minutes and they perked up and everything looked peachy, but not seeing behind the curtain because people don't want to, they're not comfortable there. And being able to create an environment where people can speak honestly without feeling scolded or ashamed of their emotions on this ride, both for the person with dementia and those caring for them, is critically important. I don't think we can make sustainable change without creating that environment. And so kudos, for your company and you to be one of the first to be accepted. I believe there's only like 90 of you in the whole country.
Yeah.
So this is a very limited service at this point. And I believe there's another 300-400 that'll come online next year. But again, okay, so we get up to 500 by next year. That's still not a lot of clinics for the whole country.
Right.
But
right.
But again, it's a step in the right direction. And it's something I think that's really important for people to assess. And if you are on Medicare, I would definitely look closely at, are you on an Advantage plan or not? Where's your loved one at? Maybe sitting down with your broker and analyzing, does this make sense to switch? Because, and I know it's hard to even get an appointment to do a switch right now because this is their crazy, crazy time. So in terms of supporting the person with dementia, we talked about, maybe respite care and things like that. Are there other things? Are there like support groups that you're recommending for people? Or
so we're certainly recommending support groups for the caregivers, for the family. We also have our own that are virtual. But to your point, that sort of social prescription is so important for people who have dementia. And when you say be around peers, it's also important that we understand that the peer group changes as the cognition changes. And so I think sometimes we'll see families and maybe their loved one withdraws, so they just sort of let them withdraw, or maybe they find that they're not really able to keep up if they're going out to dinner with the couples they used to go out with. But that same person might do very well in a program that is designed for people, who have some cognitive impairment, because they may feel more comfortable and more able to socialize there. I know that at least with one of our current patients, that was the case. There was a lot of, sort of mood and depression, and a lot of that's lifting just by helping them find a place where they can be with peers.
Yeah, I agree. And I think that that's something important. And I'll do a little pushback on that too, because I think sometimes, again, it's our comfort level as families bringing somebody out and an embarrassment, and we don't know how to deal with it. And so we kind of put them in a box sometimes.
Yeah.
I highly recommend, and I don't know if you're familiar with memory cafes, but they are.
Yes, I was going to mention that. Yeah.
Fabulous for both the people with dementia and their care partner. And those, what I have found is people stick with those groups. Initially, there's some pushback of, I don't want to be around somebody like that. But then they realize they can learn from those that are further along on the process because they know eventually that's what's going to come. But I have seen such a grace in those groups and such an immediate acceptance, and the bonding is unbelievable. I can get somebody who doesn't want to be there, and by the end of the session, I could put them in front of a camera crew and they would be an advocate. I mean, it's just such a significant difference because it breaks down the stigmas that the family and the person with dementia thought too. And so I really encourage people to check those out. I know for myself, I didn't. First of all, memory cafes weren't around when I was going through this with my mom, but I didn't go to support groups because I had this attitude of, I don't have any more time to do anything else for her, and I really felt like the group, like if I went, I was going for her. That's how I had it in my head. I didn't really see it as a support for me. And maybe part of it was I was in the field and, felt like I knew more than the average bear. And I went one time to go see a colleague speak, and he got sick and didn't show up. And so I'm stuck in this meeting. And thank God that happened to me because it changed my whole perception of those meetings. I mean, in an instant. And I thought, oh my gosh, I can't wait to come back. These people get it.
Yeah.
I had never really talked with other family members that really got it and were feeling this range of emotion, the good, the bad, and the ugly, and spoke freely and had an ability to laugh and cry and just move forward together and support. I mean, the amount of lifting one another up was just incredible.
Right.
And so I really I'm a big believer in support groups, and I hate calling them support groups because I think there's a stigma in, like, there's something wrong with you that you need support. That's how society kind of looks at it. So I like to call them a gathering, because I think it's because they really are. They're a gathering of friends, and and that happens pretty quickly. And you don't always realize the friendships that you've lost or you've pushed away because you're too busy being busy caring for someone else, and you don't understand the impact that has on you. I know I didn't at all. And I had wonderful friends who didn't give up on me. And I finally broke down and met them for coffee. And I was only going to meet them for coffee to tell them to stop bugging me. That was the only reason I was going. And then I stayed for like 2 hours and we laughed and we cried. And that was a moment in time where I realized how empty I was because they filled me up. I didn't know I was that empty, so I think there's all of these things that go on that we don't really look at, or we don't know, we don't even know how to analyze it because we're looking at everyone else's stuff. And so I think that this guide program is really going to be helpful for families in a huge fashion. One of the things that I hear all the time from families is, my doctors really don't understand what's going on or what the options are. And a lot of times they feel like they're educating the doctors. And I'm like, please do. Please, none of us know it all. This is constantly changing. But are you guys doing anything, with your company to really get in the mix in terms of the different variables that are available, or just even the way a diagnosis is given is so devastating. And families complain about that a lot. Given a diagnosis, they're given a prescription, another appointment. They're told to get their affairs in order, and they're kind of scooted out of the room, and they go in their car literally and cry for 2 hours before they can even drive home. And so there's a disconnect in terms of what that really means and how that impacts a family. And I don't know if you have any ideas on how you guys deal with that. I'm just going to be honest, be more apathetic and compassionate with that. It sounds like the care navigator will help tremendously in that process as well.
Yeah, and for many patients that we have, I see them first for sort of a comprehensive assessment. And sometimes if the patient hasn't had an actual diagnosis of dementia yet, because I do find for some it can be difficult to get that diagnosis, either because their primary care doctor isn't sure, or they can't get in, or so we can try and sort of help with that, or even find a way to really dig in and find out that diagnosis. But I think that this is a very common problem, and I certainly don't want to throw my colleagues under the bus. However, I do know that when I was in in-person clinical practice for 15 years, I did not have the knowledge of dementia or diagnosing it. And so there was a lot of sort of pushing it off onto the neurologists. And I think the neurologists are, there's a lot, it's hard to get in, there's a lot going on. And the story that you describe is often the story that I'll hear, where they're given a diagnosis, not much else, not much, you might have to go to assisted living at some point. And so I think that for our company, we have a few goals. One would be to start working in conjunction with those physicians, with those neurologists, so that when people get a diagnosis, they also get referred to us, so that we can start that journey with them. We can start to educate them, to help them understand what it looks like, to help them, understand that, yeah, affairs in order, of course, but let's take steps. Let's get there. And also just to help understand what some of it means, what some of the treatment options are, because there's a few more of them now. And then I think another goal for us is to find a way to empower primary care doctors to start to take some of this on, to improve the access for diagnosis, and also put it in the hands of people who really know these patients and might be able to do a bit more than just hand a diagnosis and sort of not much else.
Yeah, what I hear from families is that the doctors don't feel hopeful in terms of treatment, and that really comes across, when they're getting their diagnosis. And so, they can kind of see the sadness in their eyes of, this is it, and everyone with a chronic illness, like, well, how long do we have? I mean, that's
Yes.
kind of the number one question. And, and I know you guys don't know. I mean, my mom lived 30 years. I battled for, I can't tell you how many years, people going, oh, there's no way she had it. No way, no way, no way, no way, no way. And I'm like, yeah, she was misdiagnosed for 10. She was told it was menopause, and she knew it wasn't menopause. And, when we did her brain autopsy, I don't know if you know Dr. Fry from Minnesota here, but, he's fabulous. He did the intranasal spray, kind of started that whole thing. And he looked at my mom's autopsy and he actually gasped and he apologized. He's like, I'm so sorry. He's like, but Lori, I've never seen a brain this atrophied. Never. And, that's what he does, for a living. And so he said, but, when we look at this, he's like, you have said for 30 years your mom has had dementia. And he says, we found Alzheimer's, we found Lewy body, and we found Parkinson's. And Lewy and Parkinson's were never mentioned, and so he's like, this is exactly what we should expect. And, my mom lived a really good life. I would say 27 of those 30 years, the last 3 were much more difficult. And, she was in a nursing home at that point, and staff had changed, and they had like a great team, and 3 of them all left at one time. And they never came back to that level. And so, and then, she progressed more, but people have to understand that we are, our connections never leave us, and there are so many lessons that are taught us through caring, like I didn't know there were multiple levels of unconditional love until I went through this process with my mom, and things became smaller and smaller, yet so much bigger and brighter and fuller in my heart, because our connections were on a whole different level that I didn't even know existed. Because you become quiet, you become more observant, you really don't focus on just the words anymore. You're really looking for the glint in the eye or the smile or those small little things that sometimes we forget. But those are the precious items that really tie us together as humans and stuff. So I think it's really important that people understand people can live really good lives. I just one of the programs I have other than this is called Dementia Chats. And we did a program not too long ago celebrating, our panelists who have lived 10 and 20 years, and they're still doing Zoom. They're still participating, but there's such a stigma of people can't participate or are Dementia in the Arts program where, we interview people with dementia, and some of these guys should be commissioned. I mean, they are fabulous artists that have never done art even before their dementia, and incredible, artwork that they do on so many different levels. And so I think so often we have been told to shut that down. It's not going to work, over and over and over. So to me, one of the biggest things that our, medical professionals can do is help open up the creativity of what brings family comfort and explore. I mean, the worst that's going to happen, it's not going to work or you're going to adapt it, but that's what we do in all of life, you
Yeah.
know? And this is just another adaptation, in life. But boy, you can have some just what appear to be miracles, happen in
Yeah.
terms of those connections and possibilities that, you would never know if you slam the door too early on it.
Right.
And
Yeah.
so I think, giving hope and creating that team approach to this disease, I think is a really, really positive route to be
Yeah.
able to go to. The other thing that that I noticed, and we're seeing more accessibility virtually since COVID, is all the educational programs that are out there
Yeah.
that people can, participate in. And boy, there's so much to learn, and so much of it is free, because
Yeah.
that's another cost barrier and stuff too. But again, if you get that 2,500, maybe it's worth taking a course, that is going to
Yeah.
cost you something too. Or books, families might start writing books, or the person with dementia, might start doing, videos or becoming an advocate themselves. There's the possibilities are just really, really
Yeah.
endless.
You talked a little bit about sort of that idea of prognosis, and I find I'm amazed at how many people come on and no one's ever talked to them about the stages of dementia. And so that's something that we will definitely make sure that people understand. But to your point, it's very difficult to know what someone's prognosis is going to be, or to necessarily say it's this long or that long, because everyone is different. And so, I think we sort of have to weigh the risk and the benefit of giving prognosis versus, allowing for life to unfold. And, and a lot of what you're saying about how sort of learned all of those levels of unconditional love just reminds me a bit of Jolene Bracke's book, Creating Moments of Joy. And this idea that I think one of the things that we hope is that if we're taking things off of people's plates, if we're navigating the journey with them, then they might have some breathing room to be able to see that their loved one might be different, but still they find ways to enjoy life and to find those moments of joy. So I think it is really important that we're supporting them.
Yeah, well, even like, there's choirs that are out there for
Yeah.
people with dementia and their care partners. I mean, here in Minnesota, they filled up the Ordway, which is a massive theater. And people come out and celebrate. It's not about perfection. You have what is it, the imperfect restaurants where you
Yeah.
just plan on your order's going to get messed up because the person with
Yeah.
dementia is the wait staff, and nobody cares, because
Yeah.
it's not about that. Your food will
Yeah.
still be good, and but the company will be great, and you're supporting a cause. And it's endless, the things that are out there. I love seeing the kids and the intergenerational stuff going on too.
Yes.
Haley Richmond has a couple of groups. I want to say kid caregivers, I think it is one of them. And then she has Puzzles to Remember. And she's got two little nonprofits that she's running. And I think she's still in high school. And, the puzzles she gets from companies, and then she gets kids to go into communities to do puzzles with them and engage. And they're doing things like that with the caregiver groups that she's doing to get kids to not be fearful. And she's connecting with kids all around the world. I mean, so it's cool. And I think, I think that's another thing where we've pushed back and we've isolated allowing people at all levels to participate in
Yep.
care. With my mom, I'll never forget, we used to have parties at the nursing home, and we would, have a private room, and, my mom would fall asleep a lot of times, and but the kids, we had them of all ages, were crawling under the tables and stuff. And she would always know, like 2 seconds before they came out before under the table, she would like wake up and giggle before they came out. It was like she was connected to them and just knew. And then she'd go back to sleep again. But we were fascinated by that, seeing that in the joy, or, the teenagers coming up and doing fingernail polish, or different things with the guys, just having, not being fearful, but truly engaging and learning from one another, I think is so important. I used to go into the schools and teach, and I was shocked at junior high and high school how many kids were caring for somebody with dementia. A parent, a grandparent, a neighbor, an aunt, or an uncle. But they had to come home from school and they couldn't do their extracurricular, but they really weren't educated on what it was or how to serve them best. And they really wanted to be part, but families were like, no, it's, you don't have to worry about that. And they're like, but I do, and I want to help. And they're so creative, and can really maneuver a lot of the cool technology stuff that can be wonderful for reminiscing and things like that as well. So that's cool. I want to talk also about, what your thoughts are, because this has been very frustrating for many, many families, is the change of diagnosis. So no one seems to prepare anybody that, okay, we're going to tell you it's Alzheimer's today, but it might be MCI tomorrow, and it could be Lewy body the next week. And, depending on who you see with as a doctor, I mean, some of these people, have changed their diagnosis 5 and 6 times, and no one ever prepared them that was even a possibility. And so I think emotionally setting that up and letting people know, hey, this is kind of a baby disease. We're all kind of learning the symptoms here.
Yeah.
Criteria is changing. It's kind of like cancer. It used to just be cancer, and now there's like 4,500 different types of cancer. And it seems like that's, to me anyways, where we're at with dementia. And that conversation, if it's had earlier, at least prepares people, where they're just sidetracked. Because so often, they'll say, yeah, I don't have Alzheimer's anymore. I have mild cognitive impairment. And they get really mad. And they're like, there's nothing mild about this. My symptoms haven't changed. And they get frustrated with the terms, and they get frustrated with, what does that mean now? Do I have to do all this research all over again? And then after it's happened several times, there's an attitude amongst many of, I don't really care what they call it anymore. Right. Because they're not changing how they're helping me. They're just changing the name. And so they've detached, which I don't think is necessarily, I understand it, but I don't think that that's actually a good thing to happen if we're making people feel detached from the title. So I think that that's a really important factor that we have to be honest about, because it is changing all the time. I get frustrated and I don't have it. My mom's gone. But I see others kind of spinning in it, and I get it, because you're trying so hard, and you're focusing kind of down this tunnel. And I think so often the overlap between the dementias isn't discussed as much.
Yeah, there's definitely a lot of overlap. I've even experienced this in my own family, where I have a family member where it's, is it Alzheimer's with behavioral symptoms? Is it Lewy body? I mean, I think to call it a baby disease is probably the right way. I think we're still learning so much about it. I mean, now we're seeing some new diagnostic tools coming out, be they blood tests or the PET scan with amyloid to detect the amyloid. And I could certainly imagine how frustrating it is. I think that one thing to consider is that dementia is an umbrella and all of these other diseases fall underneath it. And for the most part, the management isn't going to change significantly. Although for some things, for example, there may be some different treatments with Lewy body, and certainly with frontal lobe dementia, we know that some of the treatments that are used for other dementias might even make things worse for frontal lobe. So, I mean, those things are, important to try and tease out. But, I think the overall messaging, needs to be like, this is what we believe you have now. We're learning every day. We also now know, like to your mother's point, she had two types of dementia, right? She had Lewy body and Alzheimer's. And I don't know that was so apparent that happened even just a couple of years ago. So, we're learning more. But I think we could certainly offer people sort of things that we know, the overarching things that are going to help people with dementia. Some of the lifestyle modifications, they're doing research now on plant-based diets. Some of, certainly cognitive stimulation and puzzles. And we talked about, you mentioned some of the things you can do with an iPad. And so those things to sort of try and keep healthy. But yeah, I think it is very frustrating. And I think that, the medical profession as a whole needs to do a little bit better with admitting the unknown, because we tend to like to, be very, very concrete. This is what you have, and then not backtrack. But when we do, it's hard.
There's just so many unknowns. And like you said earlier, everybody, reacts a little bit different to the disease. And, the other thing, I don't know if you guys have dealt with or run into, but the bullying that can take place of, you don't have dementia because you don't act like my husband or my wife. And, sometimes in these social media groups, and even support groups, it can get very nasty. And people have to understand. I mean, we really have to talk about that more. And there are some personalities, that's just who they are, and that's how they're going to be. Yeah. But I think a lot of education on that can be really, really helpful, because I know when I was administrator of a couple of groups, I mean, there were people that were suicidal. They were like, they were rejected from their group. And that was like the only group that they had. And it was devastating for them. And so, and most of the groups on social media are pretty good, but you will run into, you will run into issues at times where you don't click, and it's okay to switch groups. And it could be progression, it could be personality, it could be all kinds of things, but don't ever feel like you're stuck. And again, I think that's wonderful to be able to have a navigator to be able to tell that story to, because a lot of times people don't know who to reach out, who can they trust with something like that, because, they are devastated. And, what is that line of, is someone going to be knocking at my door if I tell them I'm suicidal? Are they truly suicidal, or are they just so devastated and lost at that point?
Yes.
Reconnection. And I'm not a medical professional, to be able to know that, but I know words get tossed around sometimes too. So it's it's a journey, and it's not always an easy one, but I do feel that we have to, again, have that place where people feel safe to be honest with what they're dealing with. Because if we don't create that space, we're never going to be able to create what they need, because we're not going to really know. We're going to be peeking through the glass, peeking in the house, thinking, oh yeah, this will help them. But without that conversation, we really don't know. So this is, I just find this very, very exciting. Now, for your company, can you deal with people all through the U.S. or just in certain states?
So that's what I was going to say. We are virtual. Currently, we are live in, I believe, 16 states, and, growing all the time, but certainly a lot of the East Coast we have covered. We have California, we have Texas, we have Minnesota. So, yes, we can certainly, if anyone, wants to inquire, that we can tell them if we service their state. And if not, we can always direct them to somebody who does.
Do you know right now, is the United States covered by the 90 or so providers, or are there some donut holes? that are
Oh, that's a
missed?
really good question. Off the top of my head, I'd have to look into it. I don't know. I know there are a couple of other virtual providers, so I don't know if all together we're covering all the states.
That would be something that would be, I
Yeah,
think, important for
helpful to know. Yeah,
yeah. Yeah, and it would, because I think the public would put pressure on,
of
we need
course.
this too,
Yeah,
and how does that get handled,
yeah.
for sure with that. So, well, this is just so exciting. Is there anything else you want to talk about the guide program other than I definitely want to talk about how people can connect to you?
Yeah, the only thing I just wanted to also just make sure everyone was aware of, because we talk a lot about how so many things that caregivers have to do can really take up so much time. And you talk about when you felt like, I can't go to a support group, I already have all these things I have to do. And so some of what we do for people is researching. For example, let's say somebody wants to find someone to bring into their home. We're going to go out and we're going to vet a few places and find out the information, so you don't have to sit on the phone for hours. Let's say we've helped people find a specialist if they need that. And because anything that we can do to take off of the plate of someone who's providing care for a loved one gives them that time back, whether it's to go to a support group or like exercise or whatever it is. So just important to know that. And that, I think the other thing that sometimes strikes me, and maybe the people who listen to your podcast, maybe they're more aware, is how often I hear things from people and I hear how maybe they are a little embarrassed or ashamed of what their loved one's doing. And it is so normal. Like it's what we expect. And so, I love how you say, like, you need to be able to tell people what you need. And I think for our care navigators, nothing that they haven't heard, there's nothing, and they're really able to help people with whatever it is they need.
That is such a good point. I'll tell you another story that I had where I was really frustrated with my parents' friends, because I'm like, how do they not see this? And what I didn't realize was I was hiding it. I was
Mm,
going over, my dad had brain cancer, my mom had dementia. And so they would go out with their friends and reminisce, but I would make sure that they were dressed and groomed and had money and all set to go when they were picked up. And then they would just chit chat and everything was fine. And
yeah.
they came home one day going, "Oh, we're gonna go to Texas for the winter." And I'm like, "No, you're not. There's no way that is gonna happen."
Yeah.
I mean, that was just like an impossible feat. And everyone, and I was so angry. And then I had to sit back and go, "Well, Laura, you're not being honest with them of what's
Mm,
really going on." And reminiscing is comfortable and it's easy and it's what we do with friends and stuff. And so, it was very, very interesting. The other time was I was gifted a musician and a videographer to record my mom with the musicians singing. And I've got these clips on YouTube, and they're just amazing. And it was for an hour. She only lasted a half an hour, but they are. I can have the worst day of my life, and that's where I go, and it just grounds me and says life is good. To watch one of those. And my mom's been gone since 2014,
mm,
but I shared that DVD with a picture of my mom, the musician, and I on it, with a friend of my mom's who could never go visit her. And I think this
mm,
is a really critical piece because we try to hide dementia and we're ashamed of it. And communities do this too. They want a certain look, and no, you can't sit in the front hallway because you don't look pulled together enough
mm.
type deal. And you're going to make people feel uncomfortable. And we do a horrible job at educating people of what it looks like and that there's still joy in the moment. So I,
Yeah.
I slide this DVD over to my mom's friend who's like 76 years old. And in the middle of the restaurant, she's like screaming at me, "She looks horrible. I thought you were taking good care of her, Lori. Look at her. I'm disgusted with you. You've been lying to me all these years." And she just raming me a new one. And I kind of have that nervous giggle as I'm looking at everyone staring at me, thinking what a rotten daughter I am. And I got really quiet, and I looked at her square in the eye, and I said, "Thank you, Kay. Thank you. What are you thanking me for?" And I said, "Because until this moment, I didn't know you don't see what I see." "Lori, what do you see? Her hair's not done. She's got a billy goat hair on her chin. Her eyebrows are bushy. She has no makeup on, and blah, blah." And she just went on and on and on and on about how my mom didn't look how she used to look. And I said, "Kay, this is a picture of pure joy. This is what it looks like today." I said, "When I look at this picture, I see my mom's big smile, even though her teeth look like a rusted chainsaw with fried rice hanging off because she's scared of a toothbrush. I see her dimples. I see the glint in her eye, and her eyes kind of shut, because when we smile in our family, we kind of lose our eyes." I said, "When I look at this picture, I hear my mom giggle." My mom was so happy. This is what it looks like. And we shouldn't be afraid of that. But we don't teach people that still exists. We just look at it and we judge, and we're scared of not knowing what to do with it. And so, having these open conversations, having the support systems that you guys have in play are going to make such a humongous effect on people's lives, and how we care for people, and how we look at what the disease is or isn't. Because there's so many myths and stigmas out there that are just absolutely ridiculous. And I've been frustrated with it for many, many years, because what I found, and how I was actually encouraged to even step into this space. I used to sell real estate, and I worked in the senior housing market for 25 years. And it was my colleagues in senior housing that started having me speak on dementia, not just, transitions and things. And they said, "Lori, you're not doom and gloom and give me your money. You're about really hope and joy, and how do you live well with this?" And, a lot of that fear-based marketing was very purposeful, to get people to donate. And yet there are so many things that each of us can do at all ages and all stages of life to be part of good care. We don't have to have a degree, to care for somebody. Sometimes it's nice to have a class or some guidance, but a lot of times it's just letting our heart do what it's telling us to do, to be kind, and to be inclusive. And in the world we're living in today, that's even a rougher road for some people. And so I think getting back to, basics, to me, dementia has taught me so many beautiful life lessons, and has improved my life as a human being in terms of how I look at the world and what I expect of the world. I can't even sum it up, in any fashion there. But I really appreciate you taking the time, to be with us today. How do people get a hold of you guys?
So one way is to go to our website, which is tembo.health. And you spell Tembo, TEMBO.health. We also have a phone number people can call. That's 929-998-3626, and just follow the prompts. And we also have an email that's just, you can just hello@tembo.health.
Well, thank you. This has been a great conversation. I really appreciate your time and sharing this. There's so many people that need to know more about the GUIDE program. Do you know if like that $2,500, because I know it's expensive for people when they're looking at incontinence products, if that could be used for those?
So unfortunately, it's really meant as a respite benefit. So it can either cover a day program, it can cover in-home care, or it can cover overnight care. But it's typically care to help with it's usually to take care of that person. I At the current time, there isn't anything that I know of that would help to cover those products. But, we've had that question come up, and the care navigators will do what they can to try and find any low cost options. The other thing too is there are some grants and benefits out there. So for example, we enrolled somebody and the caregiver is a veteran, and veterans get some additional benefits. So in addition to the respite benefit, we can help them to get that veteran benefit. And there can be others in your state that we can help people to discover.
I'll just put in a plug if CMS is listening. This product is a respite, because you're not on the
Yeah.
other end changing the bedding, throw them in the shower,
Yeah.
cleaning up the floor. And when they don't have good products that can handle that, it makes a huge difference. I work with, I don't know if you know the company called Senni, and they're on this kick to get people continent and get them as free as possible, so they don't feel like they're swishing when they're walking, and being social and being able to sleep through the night.
Yep.
And one of my audience members ordered product for her daughter. She has the mentality of a young child, and they go to Disneyland or Disney World a couple times a year. And she said, I don't know if we're going to be able to go, and it'll break her heart if we can't. And they got their products, and she went down the next morning, and she said her daughter was laying in bed with a smile on her face. It was the first time ever she hadn't leaked through, and it just changed their day, and it made it possible for them to still explore and do all of the things that were important for them as a family. So I'm a big I look at respite care in a different light, because I've been on that other end too. And how it can help. Another product I'm just going to mention, I don't know if you're familiar with Artifacts, but they have a really cool product that people can work with really at any level with dementia, but especially in the earlier stages. They can do what they call an artifact, where they take a picture of something and they write a story about why it's important to them, maybe where they got it. They can actually get it assessed in terms of value. It can be used for reminiscing and legacy, but it can also be used for wills of who you want stuff to go to. And they're actually doing a study right now for people 65 years and older on brain health in their mind, and I'm going to be processing that. I'll just give a plug for them. People can email them at brainhealth@artifacts, and Artifacts is ARTIFCTS.com, or they can call them at 844-278-4328. And they're doing this study through, I believe it's the University of Massachusetts Medical School. I might be mistaken on that. But that's going to be kind of a neat process. And it's something the whole family and any age can participate in as well with that. So, there's so many things that people can explore. I should give a plug too before we wrap up for Dementia Map, which is a global resource directory that we started. And, the goal was to connect people to services, products, and tools, because I'm a firm believer people need choice and have the right to choice, and bigger isn't always better. So the Google gods are probably going to shoot me down one of these days. I don't believe necessarily in the play for pay game. There are so many cool things that are out there, from Music Men's Minds that are music therapists that do free sessions online that people can participate in, to various programs that they can find. There's a gal who has Bridgetown music therapy, and she does live music sessions as well that people can find on the calendar. Artifacts is actually having some evenings with Artifacts where people can learn more about decluttering and saving those precious items. And so there's all kinds of stuff that is out there that people just don't realize is accessible to them, or things like All's Authors that has curated, I think they're probably 400 books specific to dementia in different arenas. And there's a lot more out there to support you than you think. The guide program will be a wonderful, wonderful route to be able to do that. So again, thank you so much, Dr. Berley, for being with us today. I appreciate your time.
All right. Thank you for having me.
Thanks, everybody. I hope you enjoyed this program, and please pass this along. This guide program, which CMS is pushing out, is incredibly important. And again, don't forget our resources. We have tons of free educational resources on ALZHEIMER'S Just go to our free educational resource tab. And again, dementiamap.com, our global directory. And maybe you have a resource that you'd like listed in there. We'd love to have you. So feel free to do that, or reach out to me for an individual tour. Have a great week, everyone. Bye now.
Hi, everyone. This is Meredith from the Senior Fitness with Meredith podcast, where I discuss all things for seniors, from fitness, your health and wellness journeys, how to be all over strong and beyond. I also have my mini podcast called Motivation with Meredith. It's a great, quick motivational pick-me-up for your days. Join me, listen now, search for Senior Fitness with Meredith on your favorite podcast platform.